Let's start, though, with the media and the virus. OK, we know Victoria is the one state letting the side down at the moment. Another 75 coronavirus cases identified today. But to keep that in perspective, that's well short of the 111 it had on one day in late March before crushing the spread of the virus. And in a state with more than 6 million people, it has less than 300 active cases, only 11 patients in hospital and only 2 serious enough to be on respirators. That's tough, and we hope those 2 people pull through, but it's 2 serious cases among more than 6 million people. Most of the fever seems to be in the media.
Consecutive days of newly confirmed COVID-19 cases in the double digits. There are fears the virus could be getting away from authorities in Victoria.
Victoria is facing a reversal of restrictions.
Health authorities here scrambling.
Infections again in the double digits.
With a total of 142, including 17 new cases overnight, Victoria is currently the nation's COVID-19 epicentre.
The epicentre? There have been 10 million infections worldwide and 500,000 deaths. Australia has had 1 death in the past month.
The surge in coronavirus cases across Victoria has prompted thousands of people to flock to COVID testing sites, creating delays in excess of 4 hours. Today, Melbourne reporter Christina Hearn is at the Northlands Shopping Centre. And Chris, what's happening there now?
Well, Ali, I'm right in one of the hot spots, and I'll just show you because this testing clinic isn't even open yet, but we've already got cars lining up for people to be tested.
I counted 4 cars. There would have been more lining up for petrol around the corner. Not to be outdone, here's 7 News.
41 people have tested positive in just 24 hours, the highest spike in nearly 3 months. It comes as military personnel arrive to help tackle the state's second wave. Nick McCallum is covering the story for us in Melbourne. Nick, boots are on the ground there.
And 12 Australian Defence Force personnel have joined in the testing blitz.
What a hive of activity. And did she say second wave? This time someone was on hand for some perspective.
With school holidays underway in Victoria and Queensland and the other states starting next week, there are fears of a second wave of infection. And we're joined now by ANU Professor of Infectious Diseases, Professor Peter Collignon. Welcome to you, Professor. Thanks for being with us. Is this a second wave in Victoria?
Well, I don't think it's a second wave yet. What we're seeing is an ongoing transmission in the community. In fact, if you look at the figures from Victoria, as far as I can see, there's been low levels since the early May. So what we're seeing is an ongoing ripple.
As we were always told we should expect. And the ABC, of course, was not immune.
Brendan Murphy wasn't saying it. He didn't think we're there yet. But do you fear we're on the edge of a second wave of COVID-19 infections?
No, I don't think you can call that yet. The cases are still small in Victoria.
Not yet. Wow. Perhaps Swan has learned a bit from his fear-mongering back in March when he predicted our critical care beds would be swamped within weeks. And almost a week ago, the ABC was getting back into barracking for lockdowns.
Well, you're being strongly encouraged. I suspect by the end of the week you'll probably be told by the Chief Medical Officer of Australia that you can't go travelling during school holidays, but you're being strongly discouraged from going anywhere. It's bordering on a lockdown. This is pretty serious. The spikes in numbers, as you know, are alarming. And if it's formally a second wave, I guess we'll be told that in a moment.
9 News was careful to stress the advice of the Deputy Chief Medical Officer.
The rest of the nation watching nervously, federal authorities are downplaying fears of a second wave.
This is not a second wave, this is an outbreak occurring, and the response which is occurring is very vigorous and appropriate.
And it's not as if we weren't warned something like this was likely, in fact, inevitable.
And it is our goal to move through all of these steps to achieve that COVID-safe economy in July of this year. There will be risks, there will be challenges, there will be outbreaks, there will be more cases, there will be setbacks. Not everything will go to plan.
Look, asking the media to be calm and restrained is a lost cause, I guess. So if you're going to talk up the Victorian problem, you might as well go the whole hog. The Northern Territory News, as is its wont, went with, can Victoria and Tasmania swap, please? Victoria needs to be its own island right now. Yeah, very good stuff, as usual. Look, nobody wants this country to lose control of the virus, plainly. But it's not helpful to overstate the problems when we're trying to get the economy, society and people's livelihoods back on track.